Now, finally moving on to medicines for diseases of the nervous system. Medicines used in the diseases of the nervous system. So first we'll start off with anti-seizure medicines. Anti-seizure medicines. And the first name, the most common name, yes, excellent. What is it? Yeah, excellent. Whoever said it, absolutely correct. But that is in the complementary list. Yeah, I know you are going to say sodium valproate, valproic acid. That is a complementary list. First, let us talk about the main drugs. The first name is carbamazepine. Then this is followed by diazepam, lamotrigine. Now this has become a very integral part, lamotrigine. Please remember this. This is very, very important. Then levetiracetam. Then we have lorazepam. I'll be just writing it in a different color because there are alternatives also to lorazepam. Like lorazepam is a drug of choice in status epilepticus. All of you know it. Intravenous route is given. In case this is not available, we can use diazepam or we can also use midazolam. Then after that, Maxal for magnesium sulfate, which is given in eclampsia. All of you know eclampsia, right? Yeah, please do let me know what does eclampsia mean. Then we have midazolam. This is followed by phenobarbital. Like in the WHO list, it is mentioned like this. In the Indian system, it is barbitone. And finally, we have phenytoin. And now you're talking about those drugs which are there in the complementary list. Okay, so here I'll be starting on with the complementary list of medicines. So the first medicine here is ethosuximide, which is given in absent seizures. What are absent seizures? Please do let me know in the lovely beautiful comment section of YouTube. Then we have levetiracetam, and finally we have valproic acid. In valproic acid, very important point, avoid use in pregnancy and in women and girls of childbearing potential unless alternative if treatments are, because now valproic acid has high risk of birth defects. Valproic acid or sodium valproate, this has a high risk of birth defects, so it is very restrictive use. So now continuing the discussion where we left it off, talking about 5.2. Medicines for MS or multiple sclerosis, which all of you know what it is. So it has a complementary list again. Okay, like I told you, in essential medicine you have a complementary list, and in that complementary list we have drugs such as cladribine, glatiramir acetate, glatiramir acetate, and rituximab. So basically what I told you earlier, rituximab is a monoclonal antibody. XI means it is a chimeric form, combined form of human and animal, and MAB means monoclonal antibody. Clear so far? Great. So now moving further to medicines used in Parkinson's disease, that is medicines for Parkinsonism or Parkinson's disease. Okay. In that, the first medicine, which is an essential one, is biperidine. Then again, here we have an alternative. In case if biperidine is not available, then we go for trihexyphenidyl. Clear so far? If biperidine is not available, we go for trihexyphenidyl. Then another essential medicine according to the WHO list is levodopa plus carbidopa. Now what we can do as an alternative, I am writing the alternatives in green colored ink. Like in place of carbidopa, we can use benserazide as an alternative medicine. Benserazide, Mercedes-Benz, Okay, you can remember by this. Mercedes-Benz car. Yeah. Mercedes-Benz car going along with levodopa for a ride to cure Parkinson's, to treat or to relieve the symptoms. There is no cure of Parkinson's disease. You can just allay the symptoms, meaning providing palliative care, which I explained earlier.